balance. And that is the fundamental sort of paradox or vicious cycle that we get into, especially when we're living in a world in which we have nearly universal, ubiquitous access to highly potent, highly reinforcing drugs and behaviors, which don't just release a little bit of dopamine, but a whole huge bolus. And we're all surrounded by them all the time, every day. And over time, what that means is that we're bombarding our dopamine reward pathway with way more dopamine than our primitive brains can handle. And the result is that we end up with enough gremlins on the pain side of the balance to fill this whole room. And they are now camped out there. And that's called allostasis. So we've gone from homeostasis to allostasis. Now, allostasis is where our body has to accommodate and work very, very hard to try to restore homeostasis. And if it's unable to do that using the normal mechanisms, it essentially changes our set point. So now we've got those gremlins camped out there. They're not leaving. Even when we wait a while, they're camped out there. Our balance, it's easier to tip it to the side of pain, and it's really, really hard now to experience pleasure. And when we're not using, we're in a state of anxiety, universal symptoms of withdrawal from any addictive substance, anxiety, irritability, insomnia, dysphoria, and craving for our drug. This is the fundamental problem. If you look at rates of depression and anxiety all over the world today, they are going up, skyrocketing. Suicide rates too. Also physical pain. The richest countries in the world are the countries that have the most suicide, anxiety, depression, and physical pain. And this is by many different measures, many different survey measures, many different types of studies. So clearly we have something very strange going on here, where the more we have of the kinds of, ideal things that we think would make a good life, right? Lots of food, lots of fun stuff, lots of medicines to protect us from, illness and pain. We've clearly reached some kind of tipping point. We're now essentially more miserable than ever. And the question is why? And I do think that the pleasure-pain balance explains that. Because our primitive brains were not wired for an easy, hyper-convenient world, we are suffering as a result of all of this access to these feel-good things. The first thing that we need to do is to cut out all of these feel-good substances and behaviors, at least for long enough for essentially dopamine fasting, right? And whatever your source of dopamine is, to cut it out for long enough. Now, in my clinical experience, in my practice, because I have patients who come in seeking help for anxiety, depression, insomnia, and the first thing that I will typically do is to have them cut out their feel-good drugs and behaviors. We are hardwired to approach pleasure and avoid pain, and that's really at the heart of our dopamine reward system. Dopamine is not just about the reward, it's also about the wanting and the motivation, and it's relative dopamine, so it's whether our dopamine is above or below tonic baseline that really is at the heart of this motivational cycle.